Good morning. It's Friday, November 11th, and the elections are over. It's time for another legislative update from your North Carolina Medical Society. Congratulations. You've got Friday night TV tonight with no political commercials. Who would have thought that we'd get here after all months and months and months of political TV and signs all over the place? Couple of big changes. Everybody's been talking about them, but in the state of North Carolina, we're still waiting for some of the outcomes of our biggest races like governor and auditor. Many of the council of state seats have changed up. We're going to give you more updates about those in coming weeks. The Supreme Court and Court of Appeals races have changed. We'll be bringing you updates about those as it's applicable to issues that we're dealing with. But today, I want to focus on the legislative races because that's what we talk to you all the time about. Developing relationships with your legislators, voting for your legislators, keeping in contact with them about the issues going on in your practice. Now, we've talked about both members of the North Carolina Medical Society as well as spouses of members of the North Carolina Medical Society that we're running this year. Let's do a quick review of those. First and foremost, we've got Dr. Greg Murphy from Pitt County. Currently the only physician in the House, and he will continue to be the only physician in the House. We're very pleased that Dr. Murphy won his race. This is his first race since he was appointed before. He ran a very strong race in a very tough election. We're proud of the outcome that came there. Going all the way west, we've got Dr. Frank Marantz, who was running in Buncombe County in a swing seat. Tough race, very hard fought. He didn't quite get there, so we won't have a second doctor in the House, but Dr. Marantz really ran an admirable race. We're proud of all the efforts that he put forward. We're proud of all the efforts that you did to help him, and we hope that he will come back someday again and look forward to him possibly running for elected office again. So then turning to the spouses of NCMS members, we've got 3 people that we're looking at in the House, 3 people, incumbents, all 6 in the Senate. So continuing with the House first, you've got joining Dr. Murphy in the House, you're going to have Susan Martin, again, who is right next to Dr. Murphy, neighbors in Wilson County. And then you also have Larry Yarborough, just north here of Raleigh, who's married to a physician. Joe Sam Queen from the West was not so fortunate to win his election, so he won't be coming back. But you got 3 strong people in the House that understand your issues and can really be advocates for you. In the Senate, we also have 3 strong people. You've got Senator Andrew Brock coming back. You've got Senator Wesley Meredith and Senator Jeff Tart all coming back. So you've got folks, a core group of people that understand your day-to-day issues, how you're trying to take care of your patients, and how to communicate that to other legislators as real resources for you. In addition, though, you got your local legislators, even if they're not somebody that is in the healthcare profession. We've asked you, and I'm sure you've done it because we've asked you, to start building a relationship with those folks or continue the relationship with you that you've built with them. So what I'd ask you to do today is reach out to them. Call your legislator, call your House member, call your Senate member from North Carolina, and let them know how appreciative you are that they ran. Congratulate them on their race. If they're a new member, welcome them and offer yourself to be a resource on healthcare issues since many of them don't have that background. And make sure that you're using this week as an opportunity to get ready for the January long session that's going to be cranking up in just a few weeks. That's what we're doing. We're getting ready for the long session. So in the next couple of weeks, we're going to be talking to you about the issues that we perceive are going to be coming forward in the January session and asking you to talk to your legislators about those. So now's the time to go ahead and reach out to them and make sure that you've got that open communication so you can have conversations about issues later. We hope you have a great weekend. Look forward to catching you up on more next week when you join us for another legislative briefing. Have a good one.